Hey guys, so today we are going to talk about the differences between musculoskeletal or orthopedic-based physical therapy and more neurology and vestibular-based physical therapy. And so today we're going to first start with talking about orthopedic-based physical therapy. Orthopedic-based physical therapy is traditionally kind of what you expect out of physical therapy. You kind of have an injury, you have pain, slip and fall, car accident, things like that. You're having pain in the muscles and the joints. Musculoskeletal or orthopedic-based physical therapy are going to address those things by kind of assessing pain, movement dysfunction, and help strengthening those weak and tight muscles there. And so by doing this, we really do involve a lot of things like resistance-based exercises using weights and things like that. While also, if we come over here, we like to use a lot of spinal strengthening stuff as well. So if you're having back pain, neck pain, things like that, these David machines offer kind of a nice resisted base exercise to focus on all the planes of motion in your neck and your spine. And so starting with those resistance-based exercises and some flexibility along with weights, those are definitely good ways to address some of those musculoskeletal muscle-related issues. To address pain and things like that, we have things such as laser-based therapy as well, magnetic-based pain-related therapies as well, and we also do dry needling here at the Brain Spine Pain Institute. So now we're going to bring it over to Q and talk about neurology or vestibular-based therapy.
Awesome job, Matthew. Hey, it's Q here, and today I'm going to be talking, just like Matthew said, about neuromuscular as well as vestibular therapy. And so when people think about physical therapy, oftentimes they think about strengthening or pain, especially after some kind of injury or disease process. But what a lot of people don't know that physical therapists also do is work on your balance, work on things that may be really bothering you sensory-wise. So whether that be sound, whether that be light sensitivity, whether that be nausea, all these things can also be addressed with physical therapy. Even when we talk about strengthening, some of those things that happen with strengthening aren't just because of pain, but it may be due to some kind of nerve injury. And so we can also help facilitate and rehabilitate that. Again, just to give you guys kind of a glimpse of the clinic, and some of this stuff might be on the back video here, we use a device called Virtualis. The Virtualis provides us with a motion plate, virtual reality, that really can put you in the environment that aggravates your symptoms, and then we can work on addressing it by really just going over and over again with that same type of intervention, because that's what we really stress is what's called neuroplasticity. And so the repetition of doing it helps the nerve heal. Also, when we think about balance, people often don't realize that there's three major systems that assist with our balance, and that's going to be our vision, our inner ear or our vestibular system, and then our somatosensory or our feet. So numbness, tingling, if you have any of that, that could be affecting your balance. All these things play into your balance, and we can address them in different ways here. So we look forward to getting you guys into the clinic or maybe outside of the clinic, because we also have another device that I know a video will be coming out soon called the Vertigenius, and we can also work with some of your neurological or vestibular issues that way too. But whatever the way is, we'd love to be able to be an advocate, a resource for you here at the Brain Spine Pain Institute, and we look forward to seeing you guys soon.